Thank you for joining us for this Medicare seminar, presented to you by myself, Fanny Pacheco, and Kim Caldwell from PB Individual Insurance, also known as Polenzani Benefits. At PB Individual Insurance, our primary focus is on Medicare senior products and how they can best work for you. We bring to you over 10 years of field Medicare plan experience. We've proudly assisted hundreds of Medicare beneficiaries all over Northern and Southern California. Today, we will walk you through the process of understanding your Medicare options.
Hello, this is Kim Caldwell. We will cover a little Medicare 101. Some of this you may already know, but we feel compelled to go over it again since there are, in fact, a lot of misconceptions when it comes to the basics of Medicare. Our 101 will include what Medicare is, the components, how and when to apply, and the costs. Once we've given you your Medicare 101 refresher, we will dig into your options. Medicare is not a one-size-fits-all. There are 3 options that should be considered by you in order to select the right coverage option that fits you from both a health and wellness and financial standpoint. There are a few components we'll dig into further, such as Part D, Medicare Advantage, and Medicare Supplement plans. With this basis of knowledge, we will then cover your coverage options. We will also discuss how we can assist you through this whole process. It's important to note you are not alone in making these decisions.
What is Medicare? Medicare is a federal health insurance program for people who are 65 years of age or older, certain younger people with disabilities, and people with end-stage renal disease. Now that Medicare is going to be a part of your life, we thought you should be aware of these background facts. Medicare was founded in 1965, an easy day to remember since you're eligible for Medicare at age 65. Medicare's first enrollee was President Truman. He was also the first to receive a Medicare card. Medicare is run by the Centers of Medicare and Medicaid, also known as CMS. Medicare, 11,000 people turn 65 every day in the U.S. It's quite amazing that there are over 55 million people currently enrolled on Medicare.
Let's discuss the components that make up Medicare. A and B are what is generally referred to as original Medicare. Part A is hospital insurance. It helps cover inpatient care at hospitals. It also helps cover skilled nursing facility, hospice, and home care. Part B is your medical insurance. This helps cover physician services, hospital outpatient care, and home health care. It also helps cover many preventative services to maintain health and to keep certain illnesses from getting worse. Part C, also known as Medicare Advantage, is a health plan offered by private insurance companies approved by Medicare that combines the benefits and services covered under Part A and B, and in many cases, Part D. This is one of the options we'll be digging into later on in the presentation. Part D, Medicare prescription drug coverage. This is also offered by private insurance companies that are Medicare approved, and it helps to cover the cost of your prescription drugs. Another component we'll be covering later on in the presentation in further detail.
How and when to apply for Medicare? You have several opportunities to enroll in Medicare. The first is during your initial enrollment period, which begins 3 months before your birthday month and ends 3 months after your birthday month. This initial enrollment period consists of an enrollment window of 7 months. The next enrollment opportunity is a special enrollment period. A special enrollment period is not tied to specific dates, but rather life events. For example, if you choose to waive your Medicare coverage during your initial enrollment period because you were employed or covered as a dependent under an employer-sponsored plan, then you may qualify for a special enrollment period later when you finally decide to retire, or even if you're still employed but simply choose to come off your employer-sponsored plan. You can enroll in Medicare Part A and B by completing an online application through Medicare.gov or by making an appointment at your local Social Security office. Making an appointment will require that you call the Social Security office to schedule in advance. If you are over the age of 65 and previously waived any part of Medicare, your process will be a bit lengthier as Medicare will require proof of previous coverage. If Medicare is unable to verify previous coverage, you may be subject to late enrollment penalties.
Let's cover Medicare costs. Medicare Part A, again, hospital coverage, is usually premium-free if you or your spouse paid Medicare taxes while working at least 40 quarters. Most people get premium-free Part A. Part A does have a per benefit period deductible of $1,316, and you can have multiple per benefit costs in 1 year. Medicare Part B, again, outpatient services, has a monthly premium range of $134 to $428.60. Premiums for Part B are based on your modified adjusted gross income from 2 years ago. If your modified adjusted gross income is above a certain amount, you may pay an income-related monthly adjustment amount known as IRMA. Medicare Part B covers 80% of Medicare allowed fees billed by your providers. You are responsible for the other 20%. Providers are allowed to also bill you an additional 15% of the Medicare approved rates. This 15% markup is known as excess billing. You are responsible for these excess amounts billed by providers. There is no maximum or cap on the amount that constitutes the 20% you are responsible for in Part B. It is unlimited. Medicare Part C, again also known as Medicare Advantage, are offered by private companies approved by Medicare. If you join a Medicare Advantage plan, you will still have Medicare. However, you will get your Medicare Part A and Part B coverage from the Medicare Advantage plan, not from original Medicare A and B. These plans we will cover in more detail later in the presentation, but they often have low premiums, but they also have varying co-insurance and co-pays for some services. Medicare Part D, prescription drug coverage, also referred to as PDP, have monthly premiums ranging from $17 to $159. They can also have deductibles. The Part D monthly plan premium and deductible is determined by the plan you select. In turn, plan selection is determined by the type of drugs you currently take. We will cover Part D in more detail later in the presentation. The seminar is about understanding your Medicare options. So in order to understand the options that are available to you and how to navigate them, we'd like to provide you with deeper insight into Part D, Medicare Advantage, as well as Medigap or Medicare supplements. We believe having a deeper understanding of these pieces of the Medicare puzzle will allow you to make decisions about your health care that truly work for you.
Medicare Part D, also called the Medicare Prescription Drug Benefit, or PDP, is a United States federal drug program designed to subsidize the cost of prescriptions and prescription drug insurance premiums for Medicare beneficiaries. A Medicare prescription drug plan adds drug coverage to your original Medicare. To enroll in Medicare Part D drug coverage, you must join a plan ran by an insurance company or other private company approved by Medicare. If you decide not to sign up for Part D coverage when you are first eligible, you'll likely pay a late enrollment penalty later when you do decide to join the program, unless you have other credible prescription drug coverage or if you receive extra help. If you are subject to a Medicare Part B IRMA adjustment because your adjusted gross income from 2 years ago is over a certain amount, then you will also pay an additional IRMA fee for your prescription drug coverage. Most Medicare prescription drug plans charge a monthly premium. You pay this in addition to your Part B premium. Your actual drug plan cost will vary depending on the following criteria: the drugs you use, which can be brand or generic, the plan you choose, whether your drugs are on the plan's formulary, whether you use a pharmacy that is in or out of network, and whether you get extra help paying for your drugs. Prescription drug plan formularies commonly change on a yearly basis. A formulary is a plan's list of covered medicines. For this reason, all Medicare Part D members must reevaluate their Part D plan during the Medicare's annual enrollment period, which runs between October 15 and December 7. Changes made during the annual enrollment period are effective January 1st of the following year.
What is Medicare Advantage, or Part C? We talked briefly about this during the components and cost piece. But again, Part C combines the benefits of Part A hospital and Part B medical. Part C is managed by private insurance companies, certified and approved by Medicare, to offer a plan that is equal to or better than original Medicare Part A and B. In California, we have seen the majority of these Medicare Advantage plans do include prescription Part D premiums, but it is not always the case. Medicare Advantage plan pros are that they come with a 0 or fairly low premium. Also, in many cases, as mentioned earlier, it does include your Part D premium. It does not, however, include your out-of-pocket costs that come with your prescription drugs. With Medicare Advantage plans, there is a maximum out-of-pocket, unlike original Medicare where there are no maximums. On a Medicare Advantage, you have max out-of-pockets ranging from as low as $1,200 to $6,000, depending on the plan. But after that amount, you pay nothing for your Part A and B services. These plans also have additional benefits that original Medicare does not offer. Hearing aids or some over-the-counter drugs, as an example, may be included at a discount. So why wouldn't anyone jump up and sign for Medicare Advantage as opposed to original Medicare? Medicare Advantage plans availability is subject to a network, so not all plans are available in your area. You also will have to navigate bills and statements with various copays, coinsurance, and deductibles up until your maximum out-of-pocket. Also, since these plans are subject to a network, it means you have limited providers in that network. We often describe these plans as the HMO option of Medicare here in California. You do also need prior authorization for certain treatment, which can cause delays and a level of coordination. Providers in the network can change. They can move out of a plan at any time.
And now we move on to Medigap. Medigap plans, also known as Medicare supplement plans. These policies are sold by private insurance companies. Supplement insurance can help pay for some of the healthcare costs that original Medicare does not cover, such as co-payments, coinsurance, and deductibles. There's a variety of Medicare supplement plans available for members to choose from, where some supplement plans have deductibles and some do not. Two of the most comprehensive supplement plans available are Plan F and Plan G. Some of the cons associated with supplement plans are that you have to pay an additional monthly premium for these plans. Furthermore, supplement plan premiums increase with age, and these plans do not include prescription drug coverage. On the other hand, some of the pros associated with these plans are that while enrolled in original Medicare along with the supplement plan, you will not be subject to carrier provider network restrictions. This means that you may see any provider who accepts Medicare assignment. Your medical providers will not have to request prior authorization for referrals to different specialists. Depending on the Medicare supplement you choose, the plan may pay for your Part A and Part B deductible, coinsurance, and excess charges, thus eliminating most of your out-of-pocket expenses. Supplement plans also offer coverage for services that original Medicare does not cover. For details on these additional services, you will have to reference the benefit booklet for the Medicare supplement plan you select. Now that we have explained the different components and costs of Medicare, we will move on to how these components may work for you. You have three options to consider when signing up for Medicare. Option 1 consists of enrolling in original Medicare Part A and B and Part D. This type of coverage may leave you at a risk of having limitless out-of-pocket costs. Option 2 consists of enrolling in original Medicare plus D plus a Medicare supplement. This type of coverage comes at a cost, but at its best typically leaves you with minimal to no out-of-pocket cost. Lastly, option 3 consists of enrolling in Medicare Advantage Part C, which combines your Part A and B benefits and is managed by a private insurance company. This option is typically the least expensive on a monthly basis, but you may have to pay attention to the plan's out-of-pocket maximum to understand what you may pay for during the year. Your decision will be based on your personal situation. It is imperative that you understand that all of these options are available to you. Taking the time to explore the different options is highly recommended.
A lot of time we get asked the question, how are you compensated for what you do? The reason the question comes up a lot is because we spend a lot of time with our clients, and ultimately people want to understand if they're paying extra for our services. Well, I want to put your mind at ease. We are paid directly by the insurance carrier. If you purchase your Medicare plans or prescription drug plans through us or directly through the carrier, the price to you is exactly the same. Your cost is not impacted at all by using an agent or broker like us to help you.
So what should you do next? And this pertains to whether you are looking to immediately make Medicare decisions or are a couple years away. Have a one-on-one with an agent who is AHIP certified. This is a certification that anyone selling Medicare products must have. Both Kim and I certify each year, and we would love the opportunity to assist you. In addition, Kim and I are certified with all of the top carriers such as Blue Shield, Anthem Blue Cross, UHC-AARP, HealthNet, Humana, SilverScript, and Mutual of Omaha, amongst others. Us being certified with a variety of carriers gives you access to more options and choices. Kim and I are not captive agents. We do not specifically work for any of these carriers. Our duty is to you, our client. As part of our service to you, we will guide you through the Medicare Part A and B enrollment process. We will make sure that you receive a customized options comparison and will ultimately help you make a decision. Once you are ready to apply for coverage, we will walk you through the application process. These applications can be 20+ pages in some cases. However, there is a lot of information that you may not have to complete. We are familiar with each carrier's application, and we will make this a smooth process for you. If you are already enrolled in a Medicare Advantage, Medicare Supplement, prescription drug plan, or even just enrolled in Original Medicare, please give us a call. We are constantly evaluating the plans our current clients are enrolled on, simply to make sure that they are getting the best possible coverage for the best possible price. And we would love to do the same for you. You must know that you can switch plans at various times during the year. In fact, if you are not talking to your broker at least once per year, then you definitely want to call us. There's more than likely a better option out there for you. Lastly, we'd like to thank you for taking the time to listen to our presentation. Please feel free to email or call us with any questions. We are happy to hear from you.